Hi, Raghu Othray here, double board certified facial plastic surgeon in Houston, Texas. Here's a lovely case of a young woman who shows up to my office asking for a rhinoplasty. She's a splendid young lady. She shows up with her mom, and upon talking to the patient and asking her what she would do with her nose, she says, "I think my nose is too big for my face." She said, "I really want a kind of a smaller, more balanced nose that's more cutesy on my face." These are some of her exact words. Her mom is present with her during the consultation, and her mom has a very defined nose. So I started using her mom as an example, and the patient says, "Yeah, I want a nose that looks more like my mom." So then we have photos here, and I'm just going to kind of assess the photos and kind of show you what some of my thoughts were when I saw this patient. So first of all, when we look at her on frontal view, she's a very pretty young lady, and you can see that her nose kind of occupies a lot of space on her face. So if I draw a vertical line here and a vertical line here, the nose should really fill in within that box right there, and you can see that the nose actually extends out of that box. So you know at least that the alar, or the bottom, the basal width of the nose, is a little too much for the face. Now if you take a look at this area right in here, looks a little wide, and she's got this large bulbous nasal tip. So the rest of her is very defined. She's very angular. She looks really kind of sharp and very defined, yet her nose just doesn't match the rest of her face. And if you look at her here on the profile view, she actually has a really nice profile. She's got a very straight dorsum here. She's got a nice amount of projection and rotation here. All of that looks really good. So basically the plan of action on this patient is to really just give her a lot more definition on the frontal view to give her a nose that's much more balanced for her face.
I'm nervous and excited because this is something I've been wanting to do for a long time. But I feel like I trust my doctor because he's been answering all my questions right, and my mom likes him too. And I feel safe, and I feel like he could do a really good job. And I'm excited for it.
Do you remember this person? So cute. And this is going to get even better. How's your breathing?
Good, it's fine.
Yeah?
Yeah.
So I was looking at the, okay, this is you before, okay? All before.
Oh my gosh. It actually looks different.
Can you, you know what I mean?
Yeah.
And then look at this. Look how cute that looks.
That's a big difference.
I know. And I mean, it just matches your face.
Yeah, I was looking at pictures from before, and like you can't tell, but when you look at pictures, it's really noticeable.
But I think that's one of the best things is the fact that it looks so natural that I bet you most people don't even know you had a rhinoplasty. No one knows. Okay. And this thing is going to shrink probably another 20% in. And this has healed nicely. Leave it alone. Don't mess with it. So, how was your experience?
It was good. I just acted like my nose wasn't there, and then I saw it every day getting smaller.
It's pretty awesome.
Yeah.
I have a lovely patient here, and she requested when she first came in that her nose was a little wide across the tip section right there. And that is all that she wanted, was to have a little bit narrower of a nose in order to give her that balanced look. So we did a rhinoplasty on her, primary rhinoplasty on her. And how much time post-op are you?
I think
Couple months.
Yeah.
She's a couple months post-op. And one of the things I was talking to her is that she said most people don't know that she's had a rhinoplasty. And I just showed her photos from before and after, and it balances her face so beautifully. I mean, she looks like this is what she was meant to have since she came out. You know, the man or woman above, this is what they were supposed to do, right?
Mhm.
So tell me about your experience. How was it? And hard,
It was
painful?
it was actually a lot better than I thought it would be, and it wasn't as painful as I thought it would be. It was I don't know, I just let it like kind of sort of do its own thing, and then it just got smaller every day.
There you go. See, that's the simplest way to put it. Just let it do its thing, and it gets smaller every day. She was a fantastic patient because she actually listened to everything, and she was very let nature take its course. So I'm going to just explain to everybody what I did. So I actually did do an open rhinoplasty in her, and I did bring this in, and I put a little strut in there. I call it you've probably seen a couple of my presentations. It's called the El Cuerno strut. And that little strut actually adds a little bit of projection and definition to that tip. And you can tell when you push it in there, it has a little bit of stiffness to it, just so that it gives it that definition that she wants. But I mean, everything just has healed bellissimo, and I love it. I love it.
I love it. Thank you.
There you go. That's her. I don't think there's anything more to say. Almost explaining to me that she also felt that the surgery wasn't as tough as what she had expected it to be. And I was telling her that rhinoplasty is one of these procedures where we frequently see 14-year-old patients, 15-year-old patients, you know, so on and so forth. And so I'm going to tell something about Mom that I don't know if she wants to share this, but she put on a very strong face, but she was a nervous Nelly. I mean, she was super nervous. She was super nervous. She had her entire family there waiting in the waiting room. Yeah. Okay. Why I wanted to grab this video is because she's not the only nervous mom out there. Okay. So moms entrust me with their little babies that are 14 and 15 and 16 years old. They want to help their daughter. At the same note, there's still that innate feeling on the inside that they're nervous. Mm-hmm. And so I wanted the world to hear it from Mom's perspective, because, you know, she has a daughter that she thinks is perfect. I mean, I remember her talking to me in consultation. She's like, I think she's perfect just the way she is, but she wants this. And so how did you feel? What was your feeling and thoughts, and how did it go for you?
Well, I wanted her to be happy with herself. I noticed she used to spend hours in the mirror before going anywhere just to fix her nose, because she thought it was white. And it was a little white, but to me, she was still perfect and pretty.
She's yours.
Yeah. So when she turned 15, she wanted a surgery for her birthday present, and I wanted to give it to her. But we were researching, we were reading, we saw doctors in Turkey, in Argentina, in Mexico, everywhere. And we found you, and we liked your job and the videos. We checked the Instagram page. But what made us feel more comfortable is when we came to the first appointment. I mean, you took the time to explain everything. We didn't have to ask any questions, and we left and we were happy and ready to get it done. So, and it wasn't painful. She was fine the first day. She was bleeding a little bit, but I mean, like I said, I would do it again if we had to, because it was not a bad experience. It was very smooth, and she was fine. In like 2-3 days, we were shopping, eating outside, and doing a normal life.
That's awesome.
So Love it was a great experience. And we're very happy with the results. I mean, that was a scare, not only, during the procedure, but afterwards. Like, what if it doesn't look good? What if she's not happy? But she's very happy, and then, she's a lot more confident, and she doesn't spend a lot of time in the mirror.
Well, it makes me happy. All right. Have a great one. Thank you so much for everything. Mom, thank you.
Oh, thank you. Thank you.